Hi everyone, we're here on Facebook Live. Today we're doing questions and answers for Botox. So just so everyone knows, we do our daily question of the day on Snapchat. Our Snapchat is AE_skin. We also post that to our Instagram story. So you can follow us on Instagram, A_E_skin. We're also on Twitter, and you can check out our blog that I put every week. Also, I am on Real Self, which is a live community, and I answer questions on that all the time. I was just looking this morning. I have about 1,000 questions I've answered on there. So that's a community where people can ask questions about various types of services, cosmetic treatments, and so forth. So today we're going to be doing questions and answers on Botox. If you do have questions on Botox, just type them in and I'll answer them. In the meanwhile, I'll go through the kinds of basic things that we talk about when we talk about Botox for patients. Botox is a purified protein used to address certain wrinkles associated with facial expressions. Common areas include the horizontal lines seen when you raise your eyebrows, the vertical lines or the frown lines seen between the brows when we frown, and the crow's feet around the eyes seen when we smile or squint. When Botox is injected into the skin, it will relax the muscles and smoothen out the overlying wrinkles. So Botox is an injection, and anytime you do an injection, there's a risk for pain, bleeding, bruising, infection, redness, and swelling. We take special precautions here to minimize all of those. I personally have designed a painless technique to maximize your comfort. So people love that. Take a look at what people are saying about that on our reviews, on Yelp and things like that. If you do get a bruise, we can treat it as early as the next day with a laser. Typically, if you do get a bruise, it'll last 1 to 2 weeks on its own without any treatment. When we do a laser treatment, usually the bruise will resolve within 1 to 3 days. The results of Botox are not seen right away. It takes 3 to 7 days to see the results of a Botox treatment, and it could take up to 2 weeks for full results. So it's important to be patient. We have all our patients return 2 weeks after their treatment to make sure their results are perfect. If not, we could do a touch-up. And we can fix anything that's not perfect. If there's a little bit of movement left or a little bit of wrinkles, or if anything is asymmetric, we can fix that. Most people enjoy the results of their Botox treatment for about 3 to 4 months. At that point, a maintenance treatment is recommended. After a Botox treatment, I recommend that you avoid heat exposure, alcohol consumption, and strenuous exercise for 24 hours. And don't lie down flat for 4 hours. All of these things will bring blood to the skin, and that can cause movement of the Botox, and that can lead to side effects like droopy eyelids and blurred vision. In the pivotal studies, they found droopy eyelids occur in approximately 0.3% of the time. In my experience, it's even less than that. Other side effects include blurred vision, asymmetric smile, depending on where you place the Botox. Anytime you do a Botox injection, the Botox can obviously affect the intended muscles in the face anywhere, but it could also spread to nearby muscles. If it does, it can affect those muscles and lead to side effects. The droopy eyelid is due to a side effect when the Botox spreads to the muscle that raises the eyelid. That will lead to a droopy eyelid. That's temporary and treatable. People ask about how you treat that. You can treat it with, it's what's called apraclonidine or iopidine, ophthalmic solution 0.5%, 2 to 3 drops to the affected eye for 2 to 3 times a day. And how long does it last? It could last anywhere from a few days to up to 3 months even. It depends on how severe it is. I haven't seen it much, but the one time that I can remember seeing that with one of my patients is it lasted about 2 or 3 weeks. So let's see what other pictures we have, or what other questions we have here. Yes, so when Botox is placed here and it affects the muscles nearby here, these muscles are responsible for pulling up on the corner of the mouth when we smile. If they are relaxed from the Botox, you won't be able to raise that side. So that's one of the side effects. So what are the areas that Botox can be used? So we mentioned the 3 most popular areas. What's called the frontalis muscle in the upper forehead. This muscle is responsible for raising the brows when it contracts, and if it contracts many times over years, it leads to the formation of these horizontal wrinkles. So that's a common area. Another common area is what's called the glabella. That's the area between the brows. It's a complex of muscles that's we use to frown, so it pulls the brows inward and downward. When you relax that muscle, it can give a little bit of a lift of the inner brow, as well as relaxing those muscles to address those lines, the 11s that sometimes people have. The other area, the crow's feet around here, there's a muscle that goes around the entire eye called the orbicularis oculi, and relaxing that muscle here will relax the muscles that contract when you smile, which lead to the formation of the crow's feet. So the crow's feet are improved. A little bit of that placed in the upper area in the corners of the brows can also lead to a little bit of a lift of the brow, which is very desirable. Other areas after those 3 most common areas, going kind of from the top down, the bunny lines are lines that are sometimes seen here on the nose. When we do like that, when we scrunch our nose, or sometimes when we frown, or some people see them when they smile. This is also an area that can be treated after an initial Botox treatment. One of the things that happens after we treat with Botox here, sometimes this muscle is relaxed, and then when people try to frown, they're not able to because the muscle is relaxed. So instead, other nearby muscles, like the muscle on the nose, is recruited in order to compensate for this. So you get contraction of that muscle, and you see the formation of new wrinkles here. That can easily be treated with a little bit of Botox, a small dose here and here on either side of the nose. Other areas, some people have nasal flaring, so you can put a little bit of Botox here, and that will stop the flaring. Just under the nose, there's what's called a vestigial muscle that can pull down on the tip of the nose when we smile. So some people, especially when you see it in the profile, when they smile, sometimes the tip of the nose comes down. Not everyone has this muscle, so it's not seen with everyone, but some people do, and you can put a very tiny amount right there, and that will help with that. You can put a very small amount directly under the eye, and that will help open up the eye. You have to be careful not to put too much. You generally just put 1 unit or maybe 2 units right under the central part of the eye. If you use too much, the eye can open up, and it'll be difficult to close the eye. It can lead to dryness of the eye, and so forth. There is a muscle that goes from this area to the upper lip. It's called the LLSAN, which stands for levator labii superioris aliquinacei. What that means is it's the muscle that pulls up on the upper lip that's located adjacent to the nose. And that's treated for people who have what's called a gummy smile. Normally when we smile, you see the teeth, but for some people, the lip goes up so high that in addition to seeing the full upper teeth, we see the gums as well. If you relax that muscle with a little bit of Botox there, the upper lip is not raised quite as much, and that will improve the gummy smile. Here on the lower face, there's a muscle called the mentalis, which is the thinker. Right here, some people have a cobblestone or dimpling appearance here. when they make certain facial expressions. A little bit of Botox right here can help with that. Over here there's a muscle called the DAO, or the depressor anguli oris, which pulls down on the corner of the mouth. If you treat it with a little bit of Botox here on either side, that will elevate the corner of the mouth by about 1 to 2 millimeters, and that's really desirable when people get older, things start going downward, and you see that sad face appearance. Here is another area that we treat. Some people have an enlarged masseter muscle. The masseter muscle sits here and is used to bite. Relaxing this muscle can make it smaller and contour the lower face, giving it more of a heart-shaped appearance. It can also be used to address TMJ. Some people chew or grind their teeth a lot, and that causes an enlargement. It can also cause headaches and other problems, so this treatment will help with that. There's also what's called the Nefertiti neck lift, in which Botox is placed along the jawline. That relaxes this muscle here called the platysma, which pulls down on the jawline. So that will relax and give you a little bit of a lift, improving the definition of the jawline. This is a very good treatment to complement certain other treatments to help with that. For example, Voluma can be placed here to pull up, and you can do some skin tightening treatments here to tighten things up. So the combination of those really improves the jawline definition, as well as the new treatment for the double chin, Kybella, that will help with here. It dissolves the fat that's located here, and that will help further with the jawline definition. And finally, last place is the neck bands in the same platysma muscle. Sometimes people clench like that, and you see these bands. So Botox can be placed in those bands, and that will relax those muscles and smoothen out the bands. Those are just about all the areas that we treat using Botox on the face and neck. So the way Botox works is it goes by units. So that's how the dosing goes. So there have been studies, the pivotal trials have been done for the glabella area and the crow's feet area. Those studies demonstrated that when 20 units is used here, or 24 units for the crow's feet, 12 per side, most people will see their full results at 14 days and enjoy their results for 3 to 4 months. So that's kind of the standard dosing that we use for the glabella. I typically start with the 20 units. That's what most people use. Some people have stronger muscles, larger muscles, and they require higher dosing. Sometimes that increases over time. In general, men have stronger muscles than women, both on the body and on the face, and dosing can be higher. So typically 20 units here, 12 per side here. For the forehead, that's a little bit more variable, depends on the person. Some people have a narrow forehead, some people have a broad forehead, some people have what's called a bifid muscle, in which there are two muscles going like this as opposed to one broad muscle, so the placement is different, but typically anywhere from 10 to 20 units is used there. For the bunny lines, typically we'll use 4 units per side to open up the eyes, maybe about a unit or 2 per side. If you just want a little bit of a brow lift in the corners of the brow, we can put 6 units or so in the corner of the brow, and that will give you a lift without really treating the entire crow's feet. In terms of the lower face, anywhere from 2 to 4 units for the LL sand muscle. For the gummy smile, maybe 1 unit or 2 units. For the nasal flaring, and the same thing, 1 or 2 units. For the DSN muscle, which pulls down on the tip of the nose. Typically with the masseter muscle, we use 24 units per side. It's a larger muscle, requires higher dosage. The other muscle we did not discuss is the muscle that goes around the lips. It's called the orbicularis oris. That gets stronger over time and pulls the outer portions of the lips in if you treat with about 2 to 4 units on the upper lip and maybe 2 units on the lower lip, that will help relax that muscle. It can give you a slight pout, which is nice, and it can help with some of those vertical lip lines that you see above and below the lips. Some people call them smoker's lines, but they're not necessarily always seen with smokers. So that can be used around there. Typically in the mentalis, I use about 2 to 4 units per side there. I like to use about 4 units on each side for the DAO, which helps to relax that muscle there and lift the corners of the brow. Anytime you do either of these muscles, there's a possibility for the Botox to spread to a muscle that's right in between it, called a DLI, or depressor labii inferioris. That's responsible for pulling down on the mouth. If that muscle is affected, it can lead to a temporary asymmetric smile. And for the Nefertiti lift, I typically put about 10 units across on either side, in usually about 5 2-unit injections. And for neck bands, we typically put 10 units per band. So that's kind of an overview of Botox. If you do have questions, please type them in. Also, I do answer the questions on Snapchat and Instagram stories. Every day our Snapchat is AE_skin. The Instagram is A_E_skin. And you can also go to realself.com and ask questions. I answer a lot of those questions. Real Self, it's REALSELF.com. It's an online community where you can ask questions, and I have it pulled up here. I'll take a look at some of these questions, and maybe this will help. Okay, so 4 days since Botox injections, I've been gifted with one Spock eyebrow. So the Spock eyebrow could look like, some people say it looks like a clown, or the Jack Nicholson effect, or the Mepesdo effect, when one brow peaks like this. That can happen when you're relaxing the muscles here to give that lift, or if the upper forehead is treated and the central portion is treated but not the outer portion. The outer portion of this muscle will be able to elevate the corners of the brow. No need to worry. You could put a little bit of Botox there and on either side, whichever is affected, and that will fix that. It doesn't happen commonly, but every once in a while that happens, and that's easily corrected. Don't worry, it's not permanent. What's the difference between Botox and Dysport? And so Botox is a purified protein used to address wrinkles associated with facial expression. Other types of doctors, like neurologists and other doctors, use them elsewhere in the body for other purposes. The first neuromodulator available was called Botox. It's botulinum toxin type A. It's made by a company called Allergan. There is another form called Dysport, which is made by a different company now called Galderma. And more recently, there's a third one available called Xeomin. That's made by a company called Merz. Comparing Botox with Dysport with Xeomin is very similar to comparing Coca-Cola and Pepsi. They're different things. They essentially do the same thing. They work the same way, but they're slightly different in flavor, you might say. Botox has been studied the longest. The most is known about it. Dysport tends to spread a little bit more. That's part of the reason why I'm careful and I don't use Dysport. I don't want it to spread to areas that I don't want it to go. And then Xeomin has the characteristics of faster onset by about a day or two, but the patients that I've treated seem to prefer the results of the Botox. They see better results and they enjoy their results for longer. Let's see what other questions we have. So Botox can be treated for what's called hyperhidrosis or excessive sweating. Very interesting. It does help with the sweat glands. Some people have so much sweating that it affects them on a daily basis. Common areas of treatment include the underarms, the palms of the hands, or the soles of the feet. And the Botox injections can be done there, just like they are on the face. The injections are very superficial. They're placed right in the skin. Typically about 50 units per side is used for 100 units together. So we have another question about PRP. So that's a good question. The topic for this Facebook Live is Botox, but I'll briefly go through the PRP. PRP stands for platelet-rich plasma. It's a portion of the blood that you can isolate by drawing blood, spinning it down, and then you get a layer that is the platelet-rich plasma, and that contains growth factors, it contains the platelets, it contains a lot of things which help with rejuvenation and with healing, and that can be injected into the skin. It could be placed topically on the skin after a fractional treatment or a microneedling, and it's used in other specialties to rejuvenate things like joints. So that's a brief break to talk about PRP. Back to the Botox. Let's see. We had a question earlier this morning as to how early can you start using Botox. You can start doing Botox as early as age 18. Most commonly, people will start to see the wrinkles in their 30s or in their 40s, but there are plenty of patients that we have that start using Botox in their 20s as a preventative measure for rejuvenation. We call it prejuvenation. So it's never really too early to do Botox. Doing Botox on the same days as other treatments. So that's a good question. There are a lot of different cosmetic treatments, including Botox and other neuromodulators. Other injectables include fillers, like the traditional Juvederm. More recently, we have Voluma and Restylane Lift. You can use Restylane in this area. Under the eyes is a new filler called Volbella, which is used for enhancement of the lips. Those pretty much can be done on the same day as a Botox treatment, as can the new Kybella treatment, although I may not necessarily treat neck bands or do the Nefertiti lift on the same day as a Kybella, just because there's a lot of swelling from the Kybella and that can affect the Botox. Also, some doctors do laser treatments on the same day as Botox, and that's okay for some of the doctors. Personally, I prefer to wait a week between a laser treatment and a Botox treatment. Doesn't really matter which one goes first. The reason for that is because lasers can heat up the skin, and the heat in the skin can spread the Botox. And as we said, when Botox spreads, it can go to other areas and cause side effects like droopy eyelids, blurred vision, asymmetric smile, and so forth. So that's why I like to wait. So let's see, what other questions do we have? If you do like this Facebook Live video, let us know, hit the like button, and we will do more of these videos. Let us know what topics you'd like to hear about. We'll probably talk a little bit about fillers in another video, maybe some lasers, maybe some IPLs, maybe chemical peels, fractional lasers. We have a lot that we can talk about. Yeah, so sometimes people treat certain areas on the forehead, like just this area or just this area. When patients come to me, I recommend treating the entire forehead area, because if you just treat one area or another area, the other area that's not treated can produce wrinkles that were not seen there before. It could cause movement of the brow in terms of its position, where it's located either upward or downward. You can see a larger bulge in certain muscles if they weren't treated. So typically I like to treat both of those muscle groups at the same time. That will give a nice harmonious balance and provide a nice position of the brow, help with wrinkles and so forth. So that does it for this Facebook Live video. Thank you everyone for watching. This one was Botox question and answers. If we do have further questions, we're happy to answer them. Do send us your questions. I do a daily question of the day on our Instagram story as well as our Snapchat. Our Snapchat is AE_skin and the Instagram is A_E_skin. Of course, you can follow us on Facebook as well as Twitter, and I have a blog that I do once a week. That's on our website. It's aeskin.com. Take a look at our before and after pictures on our website, and we also have some testimonials on our website. And if you'd like to ask questions on Real Self, you can go to realself.com, ask the questions, and I typically answer a lot of questions. I've got about 1,000 questions that I've answered. Thank you, everyone, and we'll see you next time.